This is Dr. Bill Blatchford, and this is another one of our monthly webinars for our clients. And today I'm very excited about our topic and our guest. Today I have Dr. Warren Roberts. Warren and his wife Jan have been clients of ours, clients of Blatchford in the past, and we actually were doing some calculations today, and it's been almost 20 years. But in the last 20 years, Warren and Jan, who have always emphasized cosmetics, cosmetic dentistry, facial aesthetics in their practice. I've actually heard, Warren, I've heard you referred to as the Botox King. How did you get that name?
It was interesting. Jan and I and our clinic are the #1 dental provider of neurotoxins in North America. And I guess I talk about my dad, who was a famous fisherman and fishing captain, and he was the sockeye king. So they gave me that nickname of the Botox King.
All right. So what we're going to do today, and Warren has put together a training program for dentists on this subject, a specific training institute for facial aesthetics in Vancouver, and he also has a syllabus, whole thing for team members as well. And of course, as we all know, training the team to present and be enthusiastic about anything in your office is really important. Without that, nothing actually happens. So today I'm going to ask Warren some questions about just a little background on what he's done. I'm going to ask him about how he markets this, how they present it, and we're also going to talk about the economics of introducing Botox, that is neurotoxins, and dermal fillers in your practice. I'm also going to be asking some questions about would be your next step to get involved with the Pacific Training Institute for Facial Aesthetics. So Warren, why don't we start right in? Why don't you give me a little thumbnail sketch of how you got interested in neurotoxins and dermal fillers?
Well, it came actually from my wife, Dr. Janet Roberts. Of course, from a woman's point of view, she was wondering, why does a woman have to go here for her tooth alignment, here for her orthodontics, here for some laser hair removal, another place for Botox, another area for dermal fillers? Why couldn't it be done in one office? So in the just at the turn of 2002, 2003 in there, her and another orthodontist actually started looking and touring North America to areas that said they did this. And of course, we found they didn't do it. So what we did is did a new office from scratch with no patients in downtown Vancouver, actually Cole Harbour, Vancouver, based on incorporating all these different treatment modalities that treat the head and neck.
Very good. So one-stop shop.
Yes, and people, if you actually look at the skill set of dentists, it's very easy for them to incorporate it.
Now, you've lectured all over the country, all over North America, for the last several years, and you've trained a lot of people in this. Well, let's talk today about, because most of the people listening to this are general dentists. We have a few specialists, but mostly general dentists. Existing practices, and this would be added as to augment their practice, another service they can add. How would you, what are the things that you suggest in marketing this service?
The key thing that I've found over 40 years of experience in dentistry is that if you don't train your team, it never gets instituted and accomplished. So the key thing at Pacific Training Institute is that we have, while I'm training the hands-on portion of the physicians, nurses, and dentists, we have my wife who's training all the teams. So that would be the hygienists, the front desks, the office managers, reception assistants. So you're training the entire team so that when they're in the office, everyone's on the same page. So that is the key thing. Then what we developed, coming from a dental perspective, our physician colleagues really don't take a lot of photography. And in dentistry, we tend to take a lot of photography, and actually the way you improve clinically, and particularly aesthetics, is you take some photographs and you look at it and say, wow, I need to improve on that a bit. So what we started doing is we started doing a series of different angled photographs of the head and neck. And we refined it to 29 photographs, and this is called the Roberts Facial Rejuvenation Photography Series. In Canada now, there's a platinum standard that has been set by the ADA&C in Alberta, and basically that is mandatory. So for licensing and for legally in Canada, it's now the standard. So if you weren't taking it, you're sort of not quite up to the standard. But what happens with that, not only is it a medical legal document, we let the patients look at their own photographs. We don't tell them what we think they should do. And when they look at their own photographs, we print out one of the first photographs of them, and they take a yellow marker and they mark as many things as they want treated. So what happens with that is that you're treating what a patient wants, and from a dental perspective, you tend to think that, oh, well, their teeth should come first, and it could be one wrinkle or one mole, and you treat that first, and then they have the complete smile design done. So basically, it's team training, and then we have the team take the photography. And in our office, we bat 100% that if the patient does the photography and looks at that, we're doing treatment that day.
Okay, very good. So that's really how you present it, and I like the fact that you're still finding out what the patient wants. Somebody must have taught you that some time ago. Let's go back a little bit to my original question. If a dentist would, do you do any external marketing of this, or are you strictly doing it with your patients who are coming into your practice? Now, at this point, you've been doing it long enough that you probably have people coming in asking for this. But for a general dentist out there that's doing cosmetics and reconstruction and placing implants and has a big recall program, would you be doing any external marketing as well, or would it just be marketing to those patients who are already in the practice?
We found initially we thought we had to go out as the early stages of market, and we did a couple ads and papers and that, and really didn't get anything. Then I was privy to a document from the Allergan Corporation that they had done for neurotoxins, and they found that in a physician's office, and it's the same in dentists, that 2/3 of your clients are already in your practice.
Okay, very good. So now you mentioned to me as well the team being involved in this, and in the dental practice, I mean, many of our clients have multiple hygienists, so I mean they're seeing multiple opportunities a day to present this, and you've mentioned the importance of having the team and excited about this and the team trained. So they're trained then to start the conversation, take the photograph, and get the conversation going.
Yes, and once they've shared, and my team, what we do is we say, any person that wants to have Botox is going to look at you as a practitioner and you as a team member first. So all of my team have Botox or some facial rejuvenation, and they share that with the patient. Mm-hmm. It's like, for example, you walk into a dental office and the receptionist smiles and she needs orthodontic treatment or she needs veneers. I don't think you're going to be doing orthodontic treatment. You're not going to be doing a lot of veneers. Okay.
No, that's correct. It's something we've taught for years. The dentist and the team need to have the best treatment available in the office themselves, in other words, to sell it. So, okay, so that's really, so you're saying then that at least 2/3 of the patients at this point are already in the office, and that you're not doing it. You've tried some external marketing, but it didn't really produce much, so you're not recommending that. Let's move on. Let's talk a little bit. My clients are probably very interested in the economics of this. I'm going to ask you some questions. It looks like it's a fairly easy entry-level ticket. I mean, you and I were discussing implants and what it costs to get into implants, for example. What would be the investment? Let's say a doctor goes through your training, puts his team through your training, gets the initial supplies to get started. What are we looking at, dollar-wise?
To have a Botox tray set up, to set up a system, one Botox tray would cost you $250.
All right. So one Botox tray, you're referring then to a tray for today's appointment?
Yes. So if the
Okay.
say for example you were coming in for Botox treatment, that tray would be out. They would take the photographs. They would go. If it was done in a recare appointment where the hygienist was doing some work first, she would have her other tray out with her clinical dental tray set up, and then right near that she would have the Botox tray set up, so they would just change right over.
Mm-hmm. And so then the doctor would come in with that patient, and so typically, and I know that they're all different, and I know that different appointments, you have different number of injections, etc. Typically, what would be the return, say, in that hygiene visit for that patient? Well, let's break it down. One would be the initial treatment. What would a typical fee for that be?
Typical fee for initial treatment is anywhere between $600 and $900.
Okay, and then how often then? Let's say 6 months later, you have to renew that.
Most people
recall visit.
Yeah, most people come in about 3.5 months now. It used to be 3, but the neuromodulators we're using now are pushing it to about 3.5 to 4, and that's cosmetic. And then therapeutically, for bruxism, clenching, TMD, headache, migraine, we tend to be pushing 4 to 6 months with the proper dosage.
Okay. All right. So what are we? We're looking at $600 to $900 on the initial visit, and the fee and the cost is about $250. So we're looking at $350 to $650 of net for the practice on that visit. And of course, anything we do at a visit and the patient's already in the chair, there's a lot of net in that procedure. So then the fee for the follow-up visits, are they the same?
Yes. What we found and what we try and teach is this, is that if you had 2 patients and the average recare patient probably has to be called, or there's a correspondence of about 3 or 4 telephone conversations. And what happens with they may rebook or cancel the appointment. We don't find that the same thing happens with a neuromodulator or a Botox recare. So if you're linking them together, you don't get that cancellation because the wrinkles
the wrinkles will come back, and they don't want that, so they're going back in. So it's actually going to 2 benefits that you see. Number one is you're helping with the facial aesthetics, and secondly, you're helping their dental health with their recalls because they don't miss that recall visit.
That's correct.
Very good. So okay, well this looks real good. I'm going to ask you a little bit now. What about dermal fillers? Are you also doing some of those?
Yes, we do, and we teach dermal fillers, and that's sort of the new standard it's a different training technique, okay? And a lot of individuals have problems with it. It's I think the best way to describe it is that if I said to you, I'm going to teach you veneers on Friday, and I'm going to teach you implants on Saturday, I hope the dentist would run, okay? And the same thing as when we say we're going to teach you Botox on Friday and fillers on Saturday, the same thing. There's different learning curves. And the key premise of Pacific Training Institute is patient care and no negative side effects, just good results. So our physician colleagues have between 2 and 9 percent of negative side effects. Whereas we in the Pacific Training Institute don't even have anywhere near that. It's not even 1%. I mean, just, you know.
Well, I think it's, you know, and you and I were talking about this earlier, but dentists have a very unique skill set. You know, you're working with your hands all day long. You're very much attuned to aesthetics. You're very much attuned to head and neck, face. And whereas, I'm not going to even compare it to physicians, but we know the dentists have that skill set. And so, and the other thing that I think the dentists have, of course, is the people skills that to get the acceptance of this and to work with the patients on this. And I think also the people skills that dentists develop are probably part of the reason, Warren, that we don't have the complaints that physicians have, is they just don't have, well, I won't say that again. I'm not comparing to the physicians. I'm just saying that dentists have excellent communication skills. And we tend to hire auxiliaries also with good excellent people skills. And so, as you know, a lot of the complaints that come from any business, whether it be medicine, dentistry, or computer stores, or a coffee shop, is very often not the quality of the service or the good provided, but the communication skills of the providers. So this is very interesting. And Warren, I've heard you also, besides being known as the Botox King, I've heard you referred to as the John Coyce of neurotoxins and dermal fillers. And I heard that at AECD this last year, and I thought that was a very nice compliment, because everybody on this call knows and respects John Coyce a lot. So to put you in that same category is a feather in your cap. So we're saying here that a doctor could add this to practice. It doesn't take any additional marketing expense. We've already got the patients coming in, and this is just an adjunctive service that someone can add, and the entry cost is fairly low. The return is quite high.
It is, the return is really high, and you get patient satisfaction. Whereas, when you do some really nice aesthetic work, the patient doesn't always come up and give you a headache. Not a headache, a hug. Okay. Sometimes give you a headache. Whereas in facial rejuvenation, when you're doing the actual neuromodulators, you basically could, if I open my hands in 2 weeks, you would actually they'd come up and give you a hug. One of the key things is that we developed in our training institute is there wasn't software to help us, and what's helped us immensely is we've developed a software called FaceTech. And what it happens is that you could go with a click of a button, and you basically see all the 29 photographs that you were just taken that day. So say, for example, Bill, you had come to see us 2 weeks ago, or maybe even 6 months ago, and what happens is that you come in and you look at your photographs. You can push on one button and it will go compare, and I can compare to 2 weeks ago or 6 months ago. And so powerful. That photographic series helping the team and I get treatment acceptance. But what happened the other day, I had a lady in January, and she was going to get married, and she's getting married at 58 years of age for the first time in August. She came in and wanted some work done. I said yes. So we do it slowly: upper face, mid face treatment, lower face treatment, neck. This is with neuromodulators. And I came in and she was looking at FaceTech, and she had the compare up. And it looked like her grandmother on the left and her on the right. And I said, it looks really good, doesn't it? Her mouth was hanging open when I walked in the room. Her eyes were bulging out. And she basically said, I said, do you want to continue? Which means that, do you want to do the treatment all over again? That was 3.5 months ago. Yes.
So yeah, very good. Well, excellent. This has been just a very enlightening interview, Warren. I really appreciate this. You also mentioned something probably not as interesting to our listeners as could be, but you're also, just to give our listeners the scope of what you're doing, your syllabus is now being translated into 9 languages. So this is you're having quite a reach across the planet out there.
Yes, it's interesting is that we always, I've taken the attitude that our best syllabus is not written yet, meaning that if you can show me a better way to do something, or we can improve, we're always improving. And so the syllabus has reached a level that it's a university level syllabus. And with it in 9 different languages, we see people, physicians, nurses, and dentists coming from all over the world.
Excellent. Could you give us your contact information so our listeners and our clients who want to get a hold of you?
Our contact information would be info@ptifa.com. There's one other thing that I should maybe mention here, is that a lot of times when you go and take a course, there's no real follow-up. in the course. And this is 10 years ago, we developed the Botox Study Club. And there's no real other Botox study club in the world. So if a practitioner needs assistance with a case, it's not going as well as they want, there's a system whereby they can upload the photographs into the Botox Study Club, and we can help them online. Then we have webinars, just like we're doing now, but we have on every muscle of the head and neck, and they're about an hour and a half in-depth procedures to help a person advance, or if there's an area of the face they're injecting and they need more help in, they can sit at home and see all these different webinars, and they're all recorded.
Yeah, I just have one more question that might take you just a few minutes to explain, but also, when we first started talking about this, you were talking about the therapeutic advantage of this as well. Could you take 2 or 3 minutes and just tell us some of the things you're doing there?
It's huge. I get, when you mentioned this topic, I really get excited. Originally, I was taught by a physician, and of course, all they really did was cosmetic treatment, and mostly on the upper face. And if you've read the book called The Outliers, it was the ability of, say, the Beatles or Bill Gates to see something 10,000 times or to go over 10,000 times. And the reason I'm explaining this is that I had on my way to work every day, I would take a commuter and I would look at the photography series. And there were some cases that I was trying to get a cosmetic result, and we started playing with concentrations of the neuromodulator and the dosage of the neuromodulator. And I was trying to get an aesthetic result. And what happened is we discovered that we were starting to get rid of headaches. Then we were starting to get rid of migraines. And this was before the Allergan preamp study on migraines. We had figured it out. So what had happened is that what we were doing was modifying a cosmetic injection template with dosage and concentration and getting a huge therapeutic result. But what we got was the synergy, and this is the key thing, is that they also looked better. So when a person is down in the dumps, whether it's TMD, migraine, headache, anxiety, and depression, and all of a sudden they look better, that could be 50% of your treatment. So it's huge. So, for example, one of our presentations that we did at the AACD was on the cosmetic, therapeutic usages of Botox and their cosmetic side effects. But we went through all the specialties of dentistry and showed you how it's applicable. The biggest one that is amazing is implants, okay? And how implants, and you look and if you have failures in implants, a lot of it is muscle related. Now, in 40 years of dentistry, if you have tooth, muscle, joint, teeth, and bone, and soft tissue, muscle always wins. So prior to implant therapy, relaxing muscles to get a better integration, but also to go one step further to keep the aesthetic look really nice. It's basically keeping the muscles under control. And so one of our biggest courses is actually on that, and people just are amazed that no one else is talking about it.
Yeah, well, in some states, there are some states in the United States that dentists can only do therapeutic use of the neuro. Now, I say neurotoxins. You say neuromodulators. Are we talking the same thing?
Same thing.
Okay, very good. Okay. Well, Warren, thank you so much. This has been a wonderful interview. You've covered a lot of material with us, and I hope it generates some interest for some of our clients. And I would hope that some of them will join you in your institute and add this to their practice. Thank you very much.
Okay. Thank you.